Here's a clinical picture that is happening all the time in orthopedics that I think we are largely getting wrong. That is someone presenting with knee pain either on one side or both sides, and the clinician does some strength testing. So most commonly, the clinician will be kneeling or down near the floor. The patient will be asked to kick out, and the clinician will resist that. That's knee extensor strength. And if the patient can't hold against that force, we call it a weakness. Alternatively, or in addition, the patient could lie on her back, lift her legs straight, and the clinician tries to push that down. So testing the hip flexor strength. And what clinicians are often coming to the conclusion of, I know because I used to as well many years ago when I was a novice clinician, is that if those muscles test weak in knee extension or hip flexion, and the patient complains of knee pain, the logical conclusion is often your knee hurts because those muscles are weak. The treatment is therefore strengthen those muscles, and let's see if that knee pain goes away. And I think that is just a leap in terms of assumptions. You could also say that it might go the other way. Because the knee is painful for whatever reason, now the muscles surrounding it are weak or turned off or inhibited. And that might also be true as well, just like the first scenario, but I don't find that in most cases. When I use repeated movement testing as part 3, and in part 2 is when I take those baselines, are the muscles weak or not? Do you have normal knee range of motion, etc.? In part 3, I'm looking at repeated movement testing. So for the knee, I'll almost always look at the spine, and if needed at the knee joint, and in rarer cases at other joints like the hip. And in my clinical experience, what I find is not scenario 1 and not scenario 2, but more commonly scenario 3, where if we untweak your low back and get it moving well, the strength reappears, meaning now you can push out strongly either in knee extension strength testing or hip flexion strength testing, and the pain in the knee goes away. Do I think that it's a sequence of the back is tweaked, so the knee extensors become weak, so the knee hurts? I don't really think that's what's going on. And the reason I don't is because there's tons of weakness without pain. And I know this because I test multiple muscles on almost every single patient. And if you test thumb extensor strength, for example, that is commonly weak in my patients, but they're not complaining of thumb pain. So we can't make this strong association or causal relationship between weakness and pain. Yes, if you severed your quad, your knee would not have stability or the ability to function in a normal capacity, so it would be logical for it to hurt. But in the absence of severe muscle weakness, and these patients in the clinic are not severely weak, they can walk, they can get up from a chair. In the absence of something severe, I don't think, and this is my hypothesis, that that muscle weakness is causing the joint pain. What I think is happening is that the low back is just not moving well, and so when there's a mechanical problem in the spine, we can find these mechanical weaknesses. And again, the muscle itself is not truly weak if it regains its strength in 10 minutes. It was something mechanical not moving well, so you can't resist knee extension strength testing, you can't resist hip flexion strength testing, and secondly, as a symptom, not a sign, your knee hurts. I would love to hear if other people have analogies, but what I tell my patients is think of the spine as the foundation of the home. If it's not level, if it's not correct, then other things above it go wrong. And those are symptoms and signs, not the true root cause. And obviously the spine is above the knee, but if the spine isn't mechanically working well, then your lower extremities may not work well either. And therefore mechanical positions will be hard to hold and things can start to hurt because they're not moving well. So if you present to your clinician with knee pain and you're told without a lot of critical thought that, your weakness is probably causing your pain, just do some strength training, I think you should be a little bit more curious about a potential root cause somewhere else, because I don't see that strong relationship between random weakness and joint pain.